This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hi, and welcome to another episode of My River District. I'm your host, Viveca Gravel, River District Coordinator for the City of Owen Sound in the River District. And today, I'm sitting down with my friend, Jeri.
Hello.
Hi, Jeri.
Hi.
Now, Jeri is an RMT, so a registered massage therapist, but she has a specialty, and that is TMJ. Can you tell me a little bit about what TMJ is?
So TMJ is just like the actual jaw joint, so temporal mandibular joint. So
Okay.
a lot of people just call it TMJ, but we call it like TMJD. So temporal mandibular joint dysfunction. So we just shorten it to TMJD. It's a mouthful. So it's just, so when people say they have TMJ issues, it's just dysfunction within the joint.
Okay, and so what can cause that?
So many things. So it could be you've had an injury to the face, like a car accident, sports, contact sports where the joints coming out of alignment. It can be your bites off. So like if you have an overbite, open bite, those things can cause it. So there's a variety of different causes that can contribute to it.
So is it something you're born with, or is this something that happens to you throughout like your lifetime?
It's usually something that happens throughout your lifetime, so it can start really early, and part of that will go to the myofunctional therapy aspect of my practice. So with that, we look at the function of the tongue. So it can start in infancy, whether you're breastfed or bottle fed, because that's going to change how the tongue is functioning. So if you're breastfed, you're going to be using your tongue more. If you're bottle fed, you're using more of your cheek muscles. So that's going to deter, like the tongue function determines how the palate forms, and then it leads down to further issues with the jaw.
So even
it can.
Thumb sucking.
Yes, exactly.
Oh, okay.
Thumb sucking, yeah. How you, any habits like blanket eating. I know a lot of little kids will suck on their blankets and stuff like that. So it could be habits that have developed in early childhood, or it could be if there's a structural issue within the nasal passage, or if there's allergies and they start mouth breathing, that changes how the tongue functions, which in turns can contribute to how the jaw functions.
Interesting.
So it's like once you go down the rabbit hole, it's like a whole thing.
Just about everything I've done in my life has led me to you.
Yes, pretty much, yes.
So I am a patient, happy to say that. I've been seeing you for, a couple of months now. And what was really interesting was the initial kind of appointment where you did so many different things. And I was so impressed because you were learning so much about me to figure out exactly what was wrong with me.
Right, right. It's very thorough.
It is. So can you talk about a little bit of those things that people could expect if they were coming in as a patient?
Yeah, for sure. So it's even evolved since I've seen you.
Oh,
so in the fall, when you started coming to see me, I was taking a myofunctional therapy course, which for those that don't know what that is, it's basically we say physical fit therapy for the mouth, tongue, jaw, that sort of thing. So, so my assessment has evolved. So when you come in, we obviously look at the jaw, but I'm also looking at how your tongue functions. Just to give you a little bit of backstory, like the tongue, the lower part of the tongue will attach to the mandible, the lower jaw here. So the jaw only functions as well as the tongue does. So that's why I'm looking at the tongue. So I'm looking for signs of a tongue tie. I'm looking at how you're swallowing. Is it functional? Is it dysfunctional? I'm looking at your airway because a lot of people coming to me, I think yourself included, clench and grind, which could actually be an airway issue, which a lot of people don't think. They think it's just I'm stressed. But it can actually be an airway issue. So we look at signs of sleep disordered breathing. We look at the function of the jaw. So we look through range of motion of the jaw. How's your jaw moving? Is it moving well, not well? So we cover a lot in that very first appointment, which can be very overwhelming. So
it's not. It's really great, actually.
Well, a lot of people, they're like, oh, like they're starting to connect dots. Like, okay, like I had no idea that car accident 10 years ago affected my jaw, or the fact that I thumb sucked when I was a child. So it's interesting, and that's why I love what I do, because it's you go down the rabbit hole and you get stuck there. And I just, it's so much. So I've changed it a little bit too, where I'm actually going to develop a presentation so I can show visual images as I go through the assessment.
Okay.
Just because I'm a visual learner, and I feel like that helps patients kind of understand what's going on with their body, why we're talking about what we're talking about. Because a lot of people come in, they're like, but it's my jaw that hurts. Why are you talking about my tongue?
Right.
So it's evolved and changed, and it's a lot. But I find a lot of people, they appreciate the knowledge just because they've been to several practitioners by the time they land at my doorstep, and nobody's ever explained like why certain things have contributed to their jaw pain.
Yeah, I mean, while we were discussing everything, it kind of unfolded all of these things back to the fact that I'm likely not sleeping properly. So, fuzzy, losing words, not being able to remember certain things, getting really, really tired, waking up really, really tired.
Yep.
All these other things. Like, your tongue's not working particularly well.
Yes.
Oh,
yeah.
It might be blocking your breathing.
Yes.
Oh. Yes. So now I'm going for a sleep study.
Yes, yeah, and as am I, and that's kind of what I like about it too. Is that's how I got into this. Was that I myself have had jaw issues, and I'm kind of on the same path as my patient. So I'm kind of going through some of these things with you, because I'm a grinder as well, and so I'm also having a sleep study, and we can just do it together.
Right? Have our little buzz,
have a little
tea
sleepover.
party. Yes. Yeah. I'm sure we'll sleep very well.
Yes, yeah, exactly.
I'm not sure I'm going to be able to sleep in the room, honestly. I've never done it before.
I know. I don't know if I will be either. I mean, there is other options. There are home sleep studies.
Are there?
Which I've considered. But if you do have sleep apnea, you need that hospital test in order to get like the CPAP and that sort of thing. So.
Gotcha. Yeah. So one of the reasons why I came to you was because my jaw, obviously I'm a clencher grinder, and I only recently found out that your teeth are not supposed to be sharpened to points. So.
Or flattened.
Or flattened.
Yes.
Yeah, mine are more points though.
Yeah.
Shark-like. And I suffer from a lot of headaches and things like that. And I go to massage therapy, but it's not like it's not specific.
Targeted, yeah.
So I was told by my practitioners to come and see you, and we did that assessment. And honestly, it's been going super, super well. So thank you.
You're welcome. I love
and
that.
it feels so good. It's like the most epic facial of all time. And while you're not working on like pores or anything like that. My goodness.
I feel like even if you don't have, like if you're not even having jaw pain specifically, like where you're waking up and you're conscious of your jaw hurting, I feel like everybody just needs work done to their face.
Yeah.
If you think about it, like you're talking, you're eating, you're swallowing, like those muscles are working hard. So
absolutely.
I feel like anybody could really benefit. But I mean, I am more specifically focused on the jaw pain, but I feel like everybody could benefit. Yeah.
And then when you do part of your practice inside the mouth.
Yes.
Which is fine. She wears gloves. It's totally fine.
Yes.
But it's interesting when you push on a certain point and you're asking about like referral, pain and things like that, because you'll push some part of my cheek that has never been massaged before in its life, because who would do that?
Right.
You.
Exactly.
And I can feel it like in my temple.
Yes.
And things like that. So it's interesting to kind of see how everything is interconnected.
Absolutely.
And how your jaw can be creating those headaches or breathing issues or, those kinds of things.
Yeah.
So I think that's really great. And one of the great things that you have are these, now you have some presentations, but these guys, because when I asked questions about, well, why does it do that? Or what is that? Or what's causing that pain? You're able to pick these, this handsome fellow.
Yes, which we don't have a name for yet. What did we discuss?
I said Hamlet.
Hamlet. Okay, I think we'll stick with Hamlet.
Okay.
Yeah, I like that. So yeah, I use this definitely as an education tool just because, I don't know, I'm a visual learner, so I like to show people and educate as we go. Like, this big muscle here, this is be tight when you're clenching and grinding, and it can refer to like your teeth, for example. A lot of people come in with like weird symptoms and they had no idea that it's connected to their jaw. So these guys, the temporalis and the masseter, they're major clenchers. When they're tight, they definitely can refer pain to like their upper teeth, some of the lower teeth too. Like I've had patients come in and they've done all the things, they've been to their dentist, they've done x-rays, nothing's found, and it turns out that it's actually because they've been clenching and grinding the temporalis and the masseter, which has been referring to the teeth, and we treat that, and then they're good to go.
It's wild.
Yeah. So anyways, I really do like to demonstrate and show the muscles and, how the disc is working too, because a lot of people, they don't even know that there's a disc.
Right. We
in the
actually
joint.
just talked about that.
Yeah.
You were saying something about a disc, and I was like a slip disc in your spine?
Yeah. Yeah.
No.
So the disc, so whenever people talk about clicking and popping, that's generally what you're hearing is that disc within the TMJ coming in and out of alignment. So people can get their jaw locked closed where you're, it sounds weird, but like you can only open just a little bit.
Okay.
Or if you're hypermobile, sometimes that disc can actually come forward and lock you open, which can be a very scary situation.
That seems more traumatic.
Yes. Yeah, that's like we're going to the emergency room kind of situation.
Yeah.
But with that said, I've had like a patient actually, we're going through the assessment and she open locked right in front of me and I'm like, oh my God, what do I do? So, we massaged it and we were able to get it. But yeah, it's the disc coming in and out of alignment. So yeah, it's a good visual. People seem to really like seeing the inner workings of it. And
I feel like we're not really taught about the jaw so much in like biology class.
No, and it's like, and that's the thing that I find through doing this work is that even myself as a practitioner, like it's a very basic explanation of the jaw and how it functions and how we treat it. And throughout my work, I've noticed that with dentists, it's very basic. Mm-hmm. Same with physicians and stuff like that. So that's why it's a very misunderstood condition because it's very complicated and a lot of people don't know a lot about it.
Yeah, I had no idea there was a disc in there.
Yeah, exactly.
I knew there was some teeth.
Yeah, there's some stuff in there doing things.
Doing things.
Yeah.
I assumed there were muscles. I had no idea they were kind of laid out like this.
Yeah.
Which explains why, if you have a temple massage, it feels so good.
Yes, exactly. Exactly.
Yeah. So as part of your practice, you do jaw massaging.
Yep.
You go inside, you massage the inside muscles of your mouth.
Yep.
You do take a look at the tongue. But the treatment doesn't include just this.
No,
right?
no.
It includes the entirety of the head. You do neck.
Yep.
You include a little bit of shoulders, that
Yep.
kind of thing, because it's all interconnected, right?
Totally. Yep.
Yeah. So it does feel like a day at the spa.
Usually, most people walk out feeling pretty good. Although, some people, are a little flared up after, which I always caution.
Yep.
Some people, it can stir things up a little bit, but we watch how it goes. I definitely give home care after, things to avoid, things to incorporate to make it less so. But generally speaking, most people walk out feeling pretty good after the treatment.
Okay, we're going to talk more about that when we come back from break. But how do we look you up online?
So my website is thetmjclinic.ca. So
Easy.
that's a great place to find me. I'm active on social, so mostly Instagram.
Okay.
So it's the TMJ Clinic is my handle. And so you can find me on either of those places.
Perfect. When we come back from break, we're going to talk a lot more about this.
Okay, perfect.
See you soon.
Hi there, my name is Tracy Hinchberger and I represent the Kincardine District Chamber of Commerce. I hope you will join us for our next segment of Chamber Chat on Rogers TV, a fascinating behind-the-scenes look at some of our member businesses. You'll learn more about local special events, restaurants and retail, not-for-profit organizations, and services in this community. Check out our schedule at www.rogerstv.com for more information. I can't wait to Chamber Chat with you soon.
As Ontario heads to the polls, Rogers TV brings you coverage of the candidates running to be your Queen's Park representative. Tune in for the local campaign as this election's most important local issues are addressed.
I really want to hear from my candidates this time. There's so much on the line.
And on election night, watch the local results. Coverage focused on the numbers from your local ridings. Make Rogers TV your election destination.
Hi, I'm Carol Merton, host of HealthLink on Rogers TV. HealthLink connects home, community, and healthcare with interesting topics and speakers about your health and your community.
Welcome back to My River District. I'm sitting here today with Jeri Roberts of the TMJ Clinic.
Yes.
And we've been talking about our faces.
Yeah, and good depth.
Yes, and how your practice basically focuses on the health of the muscles and the discs and things like that within your mouth, which can cause so much other referral type pain and your tongue and all those kinds of great things.
Yes.
It feels like such a rich area to look at.
Yes. That's why I focus on it, because there's just so much to know.
Yeah.
I've been doing it for I went down the rabbit hole 6 years ago and then exclusively started focusing on it 3 years ago. And I mean, I know a ton of stuff about it, but I'm continuously learning. There's still much more I need to learn, and there's so much to learn about it. It's crazy.
And I love it, because every single time I come in, you're like, well, this happens too. And I'm like, I had no idea.
I had no idea. I'm mind blown.
And it's exactly it.
Yeah.
Now you put it all back in during the massage.
Yes, exactly.
So yeah, we were also talking about how it's like a full head kind of and neck experience, because it all is interconnected.
Yeah.
So I think what people might be interested in is, you are a registered massage therapist, RMT.
Yes.
So this is covered by health plans that include massage therapy.
Yep.
Perfect.
Yep.
And then you also do the
myofunctional therapy.
Yes.
Yes. It's a mouthful.
MFT, let's call it. The MFT.
Or OMT.
OMT?
Yeah. Well, it's oromyofascial.
Oh.
Yeah. So
Well,
it's
that's
like
too
a whole
complicated.
mouthful
Forget
there.
it.
Yeah.
Just look at your business card.
Yeah, exactly.
What is that then?
So it's basically looking at the muscles of the face and the tongue.
Okay.
And basically I would compare it to a physical therapy. So we're looking at the function of the muscles and correcting the dysfunction. So a lot of times that's looking at different compensations that are happening that shouldn't be happening, and strengthening muscles that are weakened. So yeah, so a lot of the times the tongue, in my experience, is the root cause for most people's jaw issues. As you remember, I talked about how the jaw can only function as well as the tongue.
Yes.
So one of the things I look at in the assessment is okay, when you move your jaw, or when you move your tongue, is your jaw also moving?
Right.
When you're swallowing, are you pushing your tongue forward, or is it going back? So I'm looking for all of these different compensations. Another one that's quite common is when people are swallowing or doing other things, they'll engage their neck. Those muscles should be turned off when you're swallowing and stuff. So if you think about all of these compensations that are happening, no wonder you're getting headaches and jaw pain, because they're working way overtime.
Absolutely. And if you look at other, physiotherapy and stuff like that, say your hips are misaligned.
Yes.
And you start using muscles on, your left or right side to compensate for that, and then the whole thing is all messed up, and you get that fixed.
Exactly.
So, of course it would make sense in the mouth as well.
Yeah, and it's just not something that's looked at as, well, like you said, comparing it to other areas of the body. So it's my jam.
Now, the age range, because you said that this can start in childhood with habits and things like that.
Yep.
But you don't treat children.
No, and that's just, for me, I know my strengths, and my strengths are, especially when it comes to engaging children in myofunctional therapy exercises, that's a skill set that
children,
I do not have. So I stick to adults, but I definitely have colleagues that I refer to for children.
Okay.
So Kara Baines, shout out to Kara. She is an amazing myofunctional therapist and dental hygienist. So she's treating my daughter, actually.
Okay, cool.
She makes things really fun. So that's her wheelhouse, and then I stick with the adults. So usually I'm seeing 18. My patient profile is usually 18 to 65.
Okay.
Mostly females too. It's typically more of a female condition.
We also like to take care of our bodies.
Yes, this is true.
Also, it feels like an amazing facial.
Yes, yes.
Because you do end with a hot towel.
I do. It's just a nice way to wrap things up.
It really is.
Yeah.
It's so lovely.
I know. Everybody's like, this is my favorite part.
Yes.
Yeah.
Absolutely. And afterwards, I can say the first time that I came to you, I did have some after pain, but that's to be expected, because if you went to the gym for the first time, you're gonna hurt for a couple of days.
And let's be honest, nobody's really going in your mouth and working in your mouth. So those muscles haven't been treated in that way. Yes.
Yeah, absolutely. So some kind of not pain, but like
like a discomfort.
Discomfort.
Yeah. But that's a good analogy. I do usually say, like, expect, you may have some discomfort. Everybody's different. Some people are fine. But you may experience some discomfort for a day or two after. And I usually compare it to, like, if you had gone to the gym and worked out and you have that sore, achy kind of feeling. I mean, pain is not good. Usually pain indicates that the pressure is too much, but that's a conversation we have during treatment as well.
Absolutely. You're very good to say, is this pressure okay? And that's not just even in like the first treatment, it's every single time you're doing it. Is the pressure okay? Does this feel okay? Really reassuring through the entire thing that the person is part of that treatment. Yeah,
and another thing too, I find a lot of people think, well, if it doesn't hurt, it's not working, and that's not necessarily the case. And usually with the face too, like, these are delicate muscles. Like, it's not like where I'm massaging like a
thigh,
a quad or a hamstring or something. So, like, we need to really be mindful of the pressure, and I don't want to send you out the door feeling worse than you came in. So, I mean, we just kind of take our time, and the patient feedback is what helps guide my treatment. So
well, I'm now super aware of my tongue.
Yes. Most people are. Like, when I tell them where the tongue should be, they're like, what? It has to be where?
Yeah, and honestly, like, I feel as though my jaw isn't as rigid as it once was. So for those of you that don't know, for proper resting tongue posture, so your lips should be together. Your teeth should be slightly apart, like that you could slide a credit card in between. I'm doing it right now.
Yeah, you're like, think.
Yep.
And then for posture, so we call this the spot. So it's like we've talked about this, where the tip of the tongue goes just behind the front teeth, and then the rest of the tongue should be suctioned to, like, lightly suctioned to those spots. So we always want the tongue lightly suctioned to the roof of the mouth, because that helps keep those jaw muscles in a relaxed position, but it also supports the jaw joints. So most people are like, oh, it's just like hanging out in the bottom of my mouth.
Yeah.
So
that looks like the tongue bed. It's like where it's supposed to be.
It's supposed to be cozy there.
Apparently not.
Yeah, so that's like one of the foundational things that I go over with my patients is proper, like, resting jaw position. And a lot of people are like, yeah, my tongue's down and their teeth are together. And so then when your teeth are together, those jaw muscles are going to be activated, which in turn leads to all the tension.
Gotcha. So. And I guess, if you go back to, if you're a mouth breather, your tongue can't be in that position.
Exactly.
Because it has to be laying somewhere it's not supposed to be.
Totally. And that's when, so there's two things that I look at when we're looking at mouth breathing in terms of the jaw. So one, mouth breathing, like, those muscles are like engaged the entire time you're mouth breathing. So it's just like holding your arm out like this for hours and hours and hours. So think of how those muscles are going to feel. So mouth breathing can really impact that. But also at night, when we talked about the airway issue and the clenching and grinding, what can happen is at nighttime when everything relaxes, if you have a low tongue posture, that tongue can slide back into the throat, block the airway. Obviously, bodies don't love that. They like to breathe.
Sure.
So then our body will respond by clenching it and grinding to help create a negative pressure to pull that tongue out of the airway.
Who knew?
Who knew?
You know.
Yes, exactly. So this is why we look at the airway. This is why we look at your quality of sleep.
Right.
Because if you're doing that, several times throughout the night, obviously you're not going to get to that deep REM sleep that you need, or the deep restorative sleep that you need. So of course you're not going to feel great the next day.
And then you're going to be me.
Yeah.
Just be in a cycle of not sleeping well and being forever tired.
Yeah, and then you wake up with the sore jaw from clenching and grinding all night.
Yeah.
We actually, when we're clenching and grinding at night, the force of that is like 10 times more than when we're chewing. So, like, those muscles are working hard. You know?
Seriously.
Coming from somebody that's like cracked teeth from clenching and grinding, so don't do that.
Yeah, it's not like you don't do these things and you're just like teaching about it. You're like, I am a patient.
I'm living the dream, not the nightmare, I should say. But working on getting the appropriate treatments myself.
And that's exactly it. It's not just going in, one and done appointment, now your jaw is fine, now you're no longer a mouth breather or anything like that. This is active care to change the way that your mouth functions.
Totally.
Without surgery.
Yes.
Without anything like that. So yes, you have the appointment, you get the massage, you have, things played with and whatnots.
Yep.
I'm nearly unconscious when this happens, so I don't follow the entire process.
What's happening here? Yeah, she's doing stuff.
That's it. It feels good.
Yeah.
But there's aftercare.
Yes,
Like you're
absolutely.
supposed to exercise at
Yes,
home.
yes.
Do you want to show me some of those exercises?
Sure, yeah. So, of course, one of the things we talked about is proper resting tongue posture,
Mm-hmm.
right? So, one of the exercises, foundational exercises that I give, I didn't bring my big toothbrush, but I can show you. So, one of the things that, so of course, we want the tip of the tongue to be on what we call the spot. So one of the things we get to do just to kind of build the awareness for your body and create that sensory input is something that you can do both in the morning and at night when you're brushing your teeth. So basically you're going to take your toothbrush and just brush that spot 5 times, okay? I don't know if I gave you this one.
No, you didn't.
No. And then you brush the tip of the tongue 5 times, and then you're going to bring the tip of the tongue to that spot and hold that for 5. So it's like 1, 2, 3, 4, 5.
Right.
1, 2, 3, 4, 5, and then spot, close, and then hold it for 5.
That's 15 seconds. That is a 15-second
yes,
exercise.
But
that you add
you're
to
going to
brushing
do
your
that
teeth.
you're going to do that for a minute. But still,
Okay,
it's like
but still.
1 minute in the morning, 1 minute in the evening.
Yeah.
So that's just building that sensory input that your brain needs. Okay, this is where we need to keep our tongue on the spot. But that's just one of the foundational things that we do. Super easy. You know, you can implement that very easily into your day. Hopefully you're brushing your
Absolutely.
teeth twice a day, I
Right.
hope. But then there's other things too that people want active relief. So that's like more of the tongue thing. But in terms of active relief for tension in the muscles, we can do a little stretch if you want for the temporalis
Sure.
and the masseter. So you might want to take your glasses off for
Alrighty.
this. So we're going to do a stretch for the temporalis here. So that's one of the big clenchers.
Okay.
I mean, you know all about
I
that.
know that guy, yeah.
So we're going to find the cheekbone here. So we're going to find the cheekbone. We're going to take the pads of our hands. So find the cheekbone. You're going to go just above. And you're going to push in and pull straight up. Give ourselves a little eye lift as we're doing it.
Oh, that feels delightful.
Yes.
And my earpiece is falling out.
Yeah. So you can do this. You can hold it for 15 to 45 seconds, whatever feels good for you. Doing that 2 to 3 times throughout the day is really going to help with that tension in there that you can get from the jaw clenching.
Right.
And to mirror that, I can give you a stretch for the masseter, which also is another clencher.
Okay.
So to mirror it, it's very similar to the first one. We're going to find the cheekbone there, okay, using the pads of our hands. We're going to go just below it. If you're not sure if you're in the right spot, you can clench. You'll feel that muscle pop underneath. Okay, so you're going to push in and pull straight down. And you're just going to hold this again for like 15. We look really cool.
Don't we look cool? This is totally normal things, people.
Yeah, totally normal. So 15 to 45 seconds.
Huh.
So that's another one. I find my clenchers and grinders typically love that one, especially if you wake up with a headache or if you wake up sore from
Right.
clenching at night. That's a good one that you can start. If you have like a heating pad, putting on heat, or doing it maybe not in the shower because you're after the shower when the
Right.
muscles are all warmed up. Those are really some really good go-to basic stretches.
That's amazing. Thank you so much for joining me. We are out of time. You're going to have to come back.
Yes.
Social media is what?
The TMJ Clinic is the Instagram handle, and then my website is the tmjclinic.ca.
Thank you so much for joining us.
Thanks for having me.
We'll see you next time.
Connect with us by visiting our website or email us at comments@rogerstv.com.
This is a perfectly healthy child. What's unhealthy are birth alerts, a racist practice that may stop this Indigenous mother from going home with her newborn. Become an ally. Rise above racism in healthcare.
Summer days, summer nights, lots of things to do, places to go, and people to see. If you're having a few drinks, be sure to plan ahead and get home safely. We don't want to pick you up. Drinking drivers risk injuries to themselves and others and take chances with their license, their jobs, and their future. Remember what's at stake and choose your ride.